The following is a community affairs presentation from the Ulster County Health Department. This is the Healthy Ulster Radio Show, a weekly presentation exploring community health and sustainability with guests representing a broad spectrum of community partners working to make Ulster County the healthiest in New York State. This program is sponsored by the Health Alliance of the Hudson Valley in Kingston, a member of the WMC Health Network.
Good morning. You are listening to Healthy Ulster Radio. I'm Dr. Carol Smith, Commissioner of Health and Mental Health for Ulster County. Joining me today is my co-host, Vin Martello, Director of Community Health Relations. Good morning, Vin.
Good morning, Dr. Smith. How are you today?
I'm fine, thanks.
Great. Dr. Smith, as our listeners know, Healthy Ulster Radio covers a wide range of subjects having to do with community health. Some of them medical and a lot that are not, but also that heavily influence community health. And today's topic is a very important one, and that is flu prevention and how people can go about protecting themselves and their families. And before we introduce our guest, can you tell us a little bit about flu, Dr. Smith, what it is, what the national and local statistics look like?
Sure. The flu is a contagious illness that is caused by a virus. It can spread very quickly from one person to another, and it can cause mild illness, but it can also cause severe illness and at times, sadly, lead to death. Certainly, the best way to prevent the flu is to get a flu shot every year. And, some of the statistics really can be very motivating in this regard, that more than 200,000 people are hospitalized every year from the complications of flu. And the numbers of deaths do vary, but we've seen up to over 40,000 deaths every year from the flu. And most of these deaths do occur in people 65 years of age or older, but sadly they can also occur in very young infants, less than 2 years of age.
And actually, flu is quite serious. I ended up, when I was much younger and even healthier than I am now, I ended up in the hospital with the flu one time. I was one of those people that thought, I'm healthy, I'm strong, why do I need this, which is what we hear today. And there I was, all night long at Kingston Hospital. So it is a serious
Oh, absolutely. Situation. And if individuals have any underlying medical conditions, such as asthma, or any sort of chronic lung disease, smokers, people with heart disease, those folks are more likely to suffer more severe consequences of the flu. Our special guest today is one of my colleagues at the Department of Health and Mental Health, Cynthia Cothy. Cynthia is one of our supervising public health nurses, and she is currently the immunization coordinator with Ulster County. Cynthia received her nursing degree from Ulster Community College and a Bachelor of Science in Nursing from SUNY New Paltz. And Cynthia has worked with Ulster County for over 20 years in various nursing roles, but she currently supervises the Immunization Action Program and our Communicable Disease Department. So welcome, Cynthia. Thank you for joining us this morning.
Thank you, and good morning.
Yeah, welcome, Cynthia. Cynthia, can you tell us a little bit about the Immunization Action Program? Give us an overview.
Oh, absolutely. The Immunization Action Program works to increase immunization rates and prevent disease by creating and distributing educational materials for both health professionals and the public. So we provide an awareness of safe delivery and effectiveness of immunizations. We also provide information on the safety, the efficacy, and the use of vaccines within the community of patients, the public, parents, to healthcare providers and healthcare organizations.
Mm-hmm. And we know that flu strains change every year. Mm-hmm. So what's new this flu season that we know about?
Well, there are a few new things this season. Number one, only injectable flu shots are recommended this season. And according to the CDC, flu vaccines have been updated to better match the circulating viruses. And the recommendation for vaccines of people with egg allergies has changed.
Oh, interesting. How do they determine what the circulating viruses are? What does that process look like?
Well, first, we can talk about how maybe the flu spreads, and I can go in later to how they determine the virus. It is quite interesting. So first, the flu does spread mainly by droplets when people cough and sneeze or talk. These droplets can land on the mouths or noses of people who are nearby, or get inhaled into a person's lungs. Less often, a person might also get the flu by touching a surface that has a flu virus on it, such as a doorknob or a table or a desk, and then touch their own mouth, their eyes, or even possibly their nose. So to avoid this, people should, of course, stay away from sick people, stay at home when ill, and it's also very important to wash hands with soap and water. If soap and water is not available, you could use an alcohol-based hand rub. Lastly, linens, eating utensils, dishes should not be shared without being thoroughly washed first, either by hand or in a dishwasher with good hot water and soap. And frequently touched areas at home should be cleaned.
I know that we have hand sanitizers all over the health department. We may be a little obsessive about it, but honestly, washing your hands is one of the best preventative measures that one can take to protect.
There's no question about that. And certainly, if one is feeling ill or has not received a flu vaccine and has been exposed to individuals who potentially have the flu, certainly to avoid coming in contact with very young babies and infants. I think that's very important because they may still be in that age where they have not been able to get the vaccine and are susceptible to getting the flu virus. And unfortunately, every year we do see some pediatric deaths due to flu. So that's also something very much to keep in mind.
Right. They're particularly vulnerable. They haven't built up any natural immunity because they haven't been exposed out there in the world.
And have not gotten the vaccine at that point.
And cannot build their own immunity. Absolutely. Those who should get vaccinated is everyone 6 months and older should get a flu vaccine every season. And this recommendation has been in place since February 2010, when the CDC Advisory Committee on Immunization Practices voted for universal flu vaccine in the United States and to expand protection against flu to more people. And it is particularly important for people who are at high risk for serious complications to get the flu vaccine.
So, Cynthia, when should an individual get a flu shot? It is a seasonal disease. Is there an optimum time?
Well, flu vaccines should begin as soon as the vaccine becomes available and continue as long as the flu viruses are circulating. Vaccinations continue to be offered throughout the flu season, even into January or later. While seasonal flu outbreaks can occur as early as October, most seasons, influenza activity peaks in January or later. Since it takes about 2 weeks after vaccination for antibodies to develop, that protects the body against influenza virus infection, it's best that people get vaccinated so they are protected before flu begins to spread in their community. Mm-hmm.
Interesting. And what are some of the complications of the flu if one gets one? What are some of the real risks? I mean, Dr. Smith covered a few of them.
Complications can include bacterial pneumonia, ear infections, sinus infections, dehydration, and worsening of already existing chronic medical conditions. So it can be quite serious.
We take it somewhat for granted. Because of vaccination, we're able to really impact the incidence of these vaccine-preventable diseases. There were periods when we did have epidemics of flu in our history and pandemics, and millions of people died during those events. So certainly vaccines are extremely effective tools to help us keep our communities safe and healthy.
Right, not only ourselves, as I understand it, but if you don't have a certain threshold, a certain percentage of the community vaccinated, it becomes a fertile ground for viruses to manifest.
Absolutely, and we're seeing that in some other diseases now, where we have breakthroughs, or because of situations where we may not have the optimal numbers of people vaccinated, we are seeing cases of mumps and measles coming back.
Mm-hmm. And that can happen that's where the word viral comes from, as we know.
Well, these viruses are present, as we say, in the wild. They are out there. It's just a question of whether or not we're susceptible to getting ill from them. And again, the susceptibility is greatly decreased by vaccination.
Well, let's pick up on this after a short break. You're listening to Healthy Ulster Radio. Be back in a minute.
The excitement continues to build. The mission of Health Alliance is now made even stronger by our new partnership with the Westchester Medical Center Health Network. By combining a legacy of community-based care with WMC Health, we are building a stronger, healthier, and more vibrant community. We'll be collaborating to provide preventive, primary, specialty, and advanced care right here where you live, where we all live. Health Alliance and WMC Health, advancing care here. Visit HAHV.org to learn more.
Welcome back. You are listening to Healthy Ulster Radio. Our topic today is the flu, and our special guest is Cynthia Cothy, who's supervising public health nurse with me in the Department of Health in Ulster County.
So, Cynthia, I got my flu shot last year. Why do I need another one? Why do we need one every year?
It's a good question, a question a lot of people ask. Flu vaccine is needed every season for two reasons. First, the body's immune response from flu vaccine declines over time. So with that, an annual vaccine is needed for optimal protection. And secondly, viruses are constantly changing. The formulation of the flu virus is reviewed each year and sometimes updated to keep with changing flu viruses. So the flu virus is not the same each year. So for best protection, everybody, again, 6 months and older, needs to get a vaccine each and every year to protect them.
Now, does the flu vaccine work right away? I mean, can one afford to wait until the last minute, or is that wise?
No, that's not really the best idea. It takes about 2 weeks for the vaccine to work and for your body to produce antibodies to provide protection against the influenza infection. That's why it's really much better to get the vaccine early in the fall before the flu season really gets underway. This way you'll know you have protection already.
Mm-hmm. And some people ask or worry perhaps that the vaccine can give them the flu. Is there any truth to that at all?
No, not really. A flu vaccine cannot cause flu illness. Flu vaccines that are administered as a shot are generally and currently made in two ways. The vaccine is made with a flu virus that has been what we call inactivated or killed, and therefore is not a live vaccine and is not infectious. And number two, sometimes it is made actually with no flu vaccine virus at all. So while the flu vaccine cannot give you flu illness, there are different side effects that can be associated sometimes with getting a flu shot. And these side effects are usually very mild and short-lasting, especially when compared to the symptoms of a bad case of the flu. And some of the minor side effects that you may have is soreness, redness, or swelling at the site where the shot was given, possibly a very low-grade fever, or maybe some aches. But these side effects occur usually very soon after vaccination and are very mild and very short-lived.
So is that a sign that the vaccination is working, that your immune system is actually kicking in and beginning to respond to that potential threat?
Could be. It's nothing. If side effects of this degree are nothing to be worried about, and usually within a day or two, they totally subside.
Mm-hmm. Well, Dr. Smith, the symptoms of flu very often parallel those of other illnesses that circulate around flu season. What are some of the symptoms of the flu, and what should we be keeping a sharp eye out for?
Okay, Vin, I'll be happy to talk about the symptoms, but there's one point that I do want to make, that there is something called an incubation period with these illnesses. In other words, if you're exposed to the flu and have not had the vaccine, that flu can be actively developing in your body, usually over about 2 days before symptoms develop, but it can be as many as 4. And you can be potentially infectious during that time period. The symptoms can vary quite a bit. They can be relatively mild, and yet they can be very severe. And again, it depends to a good extent on one's own immune response if you haven't been vaccinated, as well as any underlying medical conditions such as asthma or heart disease. But the symptoms can vary. Typically, though, it's very characteristic of the flu to have a fever with a very abrupt onset, and that fever can be anywhere from 101 to 102 degrees, 103 degrees. And very often the individuals can remember almost exactly when that happens. It's very sudden in onset. And with that fever, one really feels as though they cannot literally get out of bed. It can be accompanied by body aches, mostly back muscle ache. You can develop some cough, some runny nose, headache, chest burning, and sometimes even some eye symptoms with some eye pain and sensitivity to the light. But again, that can vary, and the symptoms can last several days. How does one know whether or not it's the flu versus some other treatable disease? Well, very often, if you are in doubt, you can see your doctor. There are rapid flu tests available. Do you want to tell us a little bit more about the rapid flu test, Cynthia?
Yes, if you present to the doctor's office, an urgent care, there is a rapid flu test that can be administered. That is just what it says. It gives the doctor a immediate result, and then he can treat you and provide you with the proper medication for the flu.
And again, it's not an antibiotic, correct? There are anti-flu medications, antivirals as we call them.
That's right.
That may shorten the duration of your symptoms by a day or two. But antibiotics do nothing for viral diseases.
So, Dr. Smith, what is the recommendation for what one should do at home if one gets the flu or a member of the family gets the flu? Where do you go?
Well, that's a really good question. Certainly, taking care of yourself, resting, making sure you're well hydrated. That's very important. When you have fever or other symptoms like that, you tend to become dehydrated rather quickly, and older folks especially are susceptible to that. So keeping well hydrated, really reducing your contact with susceptible individuals in your household. Again, I can't emphasize enough, young babies really need to be kept away from individuals with the flu. But, and some Tylenol or something like that to help with the muscle aches can be helpful. You want to avoid aspirin, but Tylenol is acceptable. And just basically caring for yourself in that very basic way over several days. If there's any kind of an increase in symptoms, a worsening or inability to breathe properly, those kinds of red flag symptoms, certainly then you should seek further medical care so that you can be adequately and properly cared for.
I remember hydration is a big one, because I remember when I did unfortunately end up in the hospital one time from the flu, it was because of dehydration, right? I had a severe fever, as you described.
Absolutely.
When I woke up and I was unable to move, I was so knocked down by it. And then, of course, there was a blizzard outside, so the phone lines were down. I couldn't reach my doctor, couldn't get, didn't drink the water, couldn't even get to the water, actually. I was so...
And here you are, a healthy person
There I
that
am.
goes to the gym and you
And always getting
exercise
the
and watch
flu.
your diet and holding the
Flu shot every
But that
year.
must have been a year you didn't get your flu shot.
Well, that was before I knew better.
Okay.
So
Before
now,
you worked for the health department.
that's right. Dr. Smith, the state Department of Health and our department does a lot to monitor flu and where it is, how it's spreading. Can you tell us about that process?
Well, the State Department of Health is a very good partner for us. In fact, every week we have a conference call where all the public health individuals, either the directors or the communicable disease people, conference in with the State Department of Health. And we monitor these disease outbreaks, flu being one of them. So we actually do know what the numbers are and what the trend is in the incidence of the flu cases, not only in our county but in surrounding counties and throughout the state. So they truly are an excellent partner, and the sharing of information is helpful to all of us. So certainly we know what is trending for New York State as well as our own local counties and regions.
And there's a lot of information out there, reliable information that the layperson can avail themselves of. Where do they find that?
Absolutely. Really the most trusted sites that all of us professionals in the business go to when we have to gain added information. The CDC, the federal agency that follows all of these diseases and has a tremendous amount of information on their website about the diseases, the symptoms, what do you do when you have these symptoms, for both. It's very valuable research reference tool for both health professionals and for patients alike. And the New York State Department of Health website, also a very valuable tool to gain some added information so that we are better educated and, perhaps not only get some answers, but also know what questions to ask of our healthcare providers.
That's terrific. Cynthia, where can people go to get flu vaccinations and for more information from our department?
Well, flu vaccinations are available at private physicians' offices, urgent care clinics, and pharmacies throughout Ulster County, and also at the Ulster County flu clinics. Ulster County Flu Clinic dates and times can be accessed through the Ulster County webpage at ulstercounty.gov/health, or by calling the Ulster County Flu Hotline at 845-340-3093, and that would provide you dates and times and locations of the Ulster County Flu Clinics. And I'll repeat that phone number, which is 845-340-3093.
That's great. Well, thank you so much, Cynthia. It's been a pleasure having you here, and it's been very informative. And Dr. Smith, as always, it's great to have your expertise on board.
Thank you.
That's about all the time we have for today. You're listening to Healthy Ulster Radio, and if you'd like more information on this topic or others, please send an email to healthyulsterradio@gmail.com. In the meantime, please tune in next week for more information that you can use to keep yourself, your family, and your community healthy and strong.
You've been listening to the Healthy Ulster Radio Show, a community affairs presentation from the Ulster County Health Department, sponsored by Health Alliance of the Hudson Valley in Kingston, a member of the WMC Health Network. Thanks for listening, and be sure to join us for another edition of the Healthy Ulster Radio Show next week.